Hey guys, this is Dr. Today we are looking at the BRCA1 and the BRCA2. So to begin with the BRCA1, it is nothing but a tumor suppressor gene. It is a tumor suppressor gene, and when we are telling it's a tumor suppressor gene, where is it located at? It is a 17q21. Now this tumor suppressor, so it is a tumor suppressor, the transcription regulation and the repair of the double strand DNA breaks. And there is a transcription regulation. Then there is a repair of the double-stranded DNA breaks. Regulation of the double-stranded DNA breaks. Now this BRCA1 is associated with the breast cancers. So breast cancer, and are commonly poorly differentiated and have a medullary features. They are poorly differentiated. They have presence of the medullary features. So by medullary features, it is nothing but a syncytial growth pattern with pushing margins and a lymphocytic response. There is a syncytial growth pattern. So the syncytial growth pattern as well as with pushing margins. So they have pushing margins. And there is a lymphocytic response. There is presence of the lymphocytic response. Then moving on, we look at the biologically similar to, it is biologically similar to that of the ER negative, also the HER2 negative. So ER negative, HER2 negative, and the breast cancers identify as the basal-like. So the breast cancers are identified as the basal-like. So there are other associated neoplasms. They include the ovarian. So there is ovarian, there is a male breast. So the ovarian male breast cancer, but lower than the BRCA2. But this is lower than that of the BRCA2. Then comes the presence of the prostate, the pancreas, and the fallopian tube. Now we'll move on to the BRCA2. So in terms of the BRCA2, it is mapped on the chromosome 13, Q1213, 12-3, whereas the BRCA1 was 17q21. So this is associated with the neoplasms are those of the ovary. So they are associated with the neoplasms of the ovary, the male breast. Next is the prostate, the pancreas, as well as the stomach, melanoma, gallbladder, and bile duct, as well as the pharynx.